you willing to take the risk on in the case of an issue, or do you want to pay more in premium? So what I call it is it's like a cost shift. Do you have a chronic issue that you see a provider for that's a specialist? Do you have to go get blood work often? These are all the kinds of things you want to think about. If you're already on a plan, one of the things I say is log into that not employer, but the carrier website, and you can log in and actually put into your personal information. You can find out what you utilized in the course of the last year. And it'll show you, you went to the hospital this many times. This is how much you paid out of pocket. So then as the next open enrollment comes and you're deciding, do I want the employer plan? Do I want the healthcare.gov plan? You can see where you spent your dollars. And then the last thing is, what can you afford on a monthly basis? The premium, that's how much you're paying for your insurance coverage. What do you want, that richer plan that gives you a lower cost when you go to the doctor and you just pay a higher premium cost? Or do you want the lower premium cost per month coming out of your paycheck, or that you're paying to the plan and a higher risk? So you'll hear things like the high deductible plan. That's taking that risk on if something should happen, and it's a lower cost. Okay, so when you are talking to your employer or they're presenting to you, one of the things, this was part of healthcare reform too, they are mandated to give you one of these documents. And this document really tells you how your plan works when things happen. What is it going to cost me? It's usually an 8 to 9 page document. This is actually set up by the federal government. This is what it should look like. You'll usually see like an abridged version. That's a 3-page doc. That I tell people is not the legal document. That's the abridged version. This is the document you're going to be looking for. And it's called the Summary of Benefits and Coverage. So for short, you might hear someone say an SBC. So this is what you're going to be looking at. And how you read it is, it tells you you have a deductible. So deductible applies. So that's that big chunk of money that you're going to pay up front for a certain service. Oftentimes you'll see that apply to things like hospitals. Some people have it apply to blood work. If it's a high deductible plan, it'll apply for your provider. So that's that bucket of money that you have to pay out first. And then you'll see the next thing says out-of-pocket limit. Some call it a MOOP, max out-of-pocket limit. That's your worst case scenario. So these are going to be things you're taking into account when you're deciding what plan works for me. What can I afford? If there's a specialist copay, this form would tell you what is your copay. This will also tell you what your prescription coverage is. What copays do I have when I go and get specific medications? This plan also, this form is supposed to tell you the website to find your insurance carrier. So you could go onto that carrier website, and again, I tell you, snoop around that website, log in, get your own ID stuff set up. It also should give you an 800 number to access the carrier. So this form is kind of important. I tell people to keep it in a safe place. You might not see it, right now. This is just a screenshot of what those definitions are that you're going to see on that form. So again, deductible, that's that amount you're going to be responsible for up front. Copay, that's when a lot of people are used to the copay. That's when I go to the doctor, I pay, say $20, $50. You will see that on that form. Read it carefully. A lot of people don't think about it till it's, you're in the ER and you don't know what you're going to be paying, what it's going to cost you. Co-insurance, that's often what we call a cost share. That's a percentage that you're going to pay. And then that max out of pocket. So these are key terms you're going to be hearing and using. Most people, again, don't think about it until they get this bill from the doctor and they don't know what these mean. So since this is going to be actually sent out to you, this whole thing is being recorded. What I'm going to say is maybe keep this webinar somewhere so you can see what these definitions are. One of the things healthcare reform did, or the ACA Act, it was really big to cover preventive care. So one of the big things you'll hear is go get your physical, right? You want to catch things early. I am not a healthcare provider, but I will tell you that, getting your physical every year, getting your children's well baby and well child checkups, and getting those immunizations, they are supposed to be covered at 100% no charge. So that's no copay, no deductible. Just remember, when you go to that doctor's office and you've set up that physical, don't tell them you're sick. If you start coughing and you tell them you're sick, what happens is that claim, that bill now changes from being preventive care, even though they covered the preventive care visit. If you're expecting not to pay anything and you tell them you're sick, it's now going to go into whatever the cost is for a sick visit. One of the things, and I'll show you what the billing looks like, but all carriers see on their back end is codes. You don't see really the language or the notes that the doctor puts in. Along with preventive care comes all of those screenings, so the mammographies, colonoscopies for screening for preventive care. If you're going for a issue, they're going to bill that according to what your benefit says for that x-ray, that lab. The other thing was contraceptives are now covered at 100%, except for there's a loophole on some plans that have opted out. So like for religious organizations, some have opted out of that. You've probably saw that in the news several years ago about which employers were opting out of that piece of it. Look at your plan design, it will tell you. Other things, any kind of cancer screening is supposed to be covered at 100%. All of these are listed actually on that benefit summary. The other thing that you get once you're enrolled in a plan is you get this long certificate, and it's like a 140-page booklet telling you all these crazy things. You can look in that. Another resource is calling that 800 number for your carrier to make sure that, yes, I'm going for this screening, is it covered? Certain screenings are according to age appropriateness. So mammography, you have to be over 40. The colon screenings, typically it's over 50. You have to look at those little details. So one of the things, now you have your plan, right? You know what's covered, you know how it's covered. How do I find a doctor? This is a big thing. I have a lot of members, employees that have issues finding doctors, or they call their doctor and their doctor's office says, yes, we accept that plan. One of the big things I say now with smartphones, go onto your smartphone, look in the App Store. If you have, say, Aetna or Cigna or Blue Cross Blue Shield, they have apps now that you can download. So what happens is I download this app, or I go online, or I call the 800 number, and I search by the provider. I search by this, specialty or an issue or condition I have, or if I'm going for a procedure. You go in, you put that in, you put in the zip code that you're looking for, and it should pop up with providers in the area that participate with your plan. Now make sure you're putting in the plan piece. Often I'll say PPO or EPO or the old HMOs. You have to make sure that you're putting in the right plan as well. This way you're going to providers and facilities that take your insurance. It's going to be in network, right? So you've now decided you want to pay copay or that deductible. You want them to participate. I understand there's needs sometimes for people to go out of network to providers that don't participate. But if you're also calling the doctor's office, make sure you say, do you participate with this carrier and this network and this plan? The key word there is participate. Because if you say, do you accept, they'll accept anything and then they will balance bill you. So make sure you're using that, code word participate. Also double check on the carrier information. They're supposed to tell you who they participate with as a lab. And make sure when you're getting lab work done by a doctor, they're sending it out to the right lab. So often around here we're talking about LabCorp, we're talking about Quest. When you walk into your doctor's office, you'll often see those little drop boxes for those different labs. That's where the blood work's going out from your doctor's office, or if you're going to the lab, make sure you're going to the correct one. You're going to end up with a bill if you don't go to a participating provider or a lab again. Okay, so I'm actually using United Healthcare's information. They're a carrier I work with. I wanted you to see though when I'm talking about going online, getting that app. You can see here. This is what their website looks like and where you can log in. Down below on the right, this is something I love. My clients love that you can do that. Looking at the App Store, pulling up United Healthcare. I could actually pull up my card. I could do all kinds of things. Another big thing that people forget, especially with the change in the way the benefits now are going, that emergency rooms are so expensive. Look for urgent cares in the area. You can find ones that participate. Those are those little pop-up areas or minute clinics like CVS, where you can get in and out using participating benefits. And, you know, it's a shorter time and it's a smaller bill. So again, that's a cost savings. Some of you might have seen United Healthcare's most recent video. In here on that little YouTube link, there's a commercial that United Healthcare put out, and you see the women sitting around the pool and the husband's doing the pole vault. You know, he looks a little ridiculous, and she's looking up the urgent care, and she goes, "Ooh, it's in network." So remember, in network, look for your providers, look for that urgent care. One of the fun things that a lot of the carriers are doing, and it's because you're taking on so much cost in order to keep that premium down, is they're now letting you find out ahead of time what a procedure costs in what facility. So now you've found a facility, you know you're going for this procedure. For example, my kid, ear, nose, and throat, out the wazoo. He's had tubes in his ears 4 times. I could tell you, you know, I actually researched and used which facility had participating doctors and how much was it going to cost. So what a lot of these things now, a lot of the carriers are doing is letting you find out what procedure. They give you an estimate. They're not going to give you exact numbers because they don't have, again, those codes that the provider's sending in. If you actually have the codes, you can do a predetermination. But what this shows you is, I'm going to get an MRI. This is the zip code. Here are the facilities, and here's how much it's going to cost. Again, it gives you the one thing with United Healthcare's website, and I'm not pushing United Healthcare, it's just that I have a lot of their information from doing presentations, is here they tell you in green the below average in the area. And then they can tell you what one is above average. So at least you, the consumer, especially when you're purchasing the insurance, knows how much you're spending and where you can shop around. So this is more about the billing. I told you about that, those codes that you're sending in. These are examples of what I want you to make sure match. So on the left-hand side, you're going to see the invoice you get from that doctor, right? The doctor's very quick to bill you. They want their money. Hold up, get that bill, make sure that it tells you that this was submitted to the insurance. You'll see adjustments. So you'll see one line item, it'll say amount, then it'll say an adjustment. This one does not show insurance, right? On the right-hand side, what you're getting is a statement from your carrier. Oftentimes you can get this through the mail, they'll send you it. Sometimes you can opt out of mail and you'll get it emailed, or it's in that online website that you've set up. Make sure that these match. If you're going to participate in provider, these have to match. And the explanation of benefits, you'll hear EOB as well, will tell you this is the amount the doctor billed. This is what's covered or not covered, and this is an adjustment of the items. Each carrier has their own format. This one happens to be a Blue Cross Blue Shield format. And what I want you to know, again, if they don't match, if you are in an employer group, pick up the phone. You can call oftentimes your broker or your HR department, or pick up the phone and call the carrier and call that doctor's office. Because if your bill doesn't match what the insurance carrier is saying, you want to do either what I call resubmission or an appeal on it. So call that doctor's office, put your account on hold, and make sure that everything works out between the carrier and your provider. We don't want you to try to pay the provider and then fight for money back. Something that a lot of people don't realize or miss, all of the carriers now have big wellness initiatives. A lot of employers have wellness initiatives. What I want you to do is whoever your provider, your carrier is, go to that website, and there should be discounts and wellness initiatives. Blue Cross Blue Shield has a new one. It's called Blue 365. This is with New Jersey's Horizon Blue Cross. What it does is you can get discounts for things that may not be covered on your medical insurance. So you might not have vision. There may be a vision discount off of your medical plan through the wellness. Hearing aids often are covered with a discount. A lot of times you can go to gyms, you can get vitamins, things of that nature. I know Reebok has actually contracted with Blue 365, and there's a discount on Reebok. YMCA is in the area. Go find out, utilize every penny that you're paying for that's for you. There's other carriers that you can link your Fitbits into, and you actually get these almost like Bitcoins for wellness programs. So I would say use everything you can and get every penny that's due to you. Some employer groups have a wellness program. Ask your HR department, do you have a wellness program? What does that mean? Do I have to do certain things? Do I get a discount on items? Is there a gym piece to it as well? So these are the resources, again, I want you to utilize. That healthcare.gov, the medicare.gov. Look on your ID card, or that SBC for the website for the carrier, the customer service. Use everything, all of the knowledge you can gain. One website I've gotten a lot of my data today from is called the Henry J. Kaiser Family Foundation. If you have some questions, that's one place that I like to go. They have a lot of updated data. They also have they have a fun, the U-Tunes they call it. It's a little cartoon that links out to YouTube that explains health insurance, some of the employer pieces on it. I know there's a lot of controversy around health insurance as a whole, the healthcare reform, where we're going. I can't really say where we're going. A lot of it's political. November may change some things. I know a lot of people have opinions about should we be going down the path of the single payer system. I think a lot of that's speculation, a lot of that is opinion. So what I just really wanted today was to go through how you should be using your insurance, things that pertain to you, the individual. You could always email me or call me. Up right now is all my contact information. My work email's there, and my student email, and my cell phone. I know you may have questions. You may have questions that are individual to you. You may have employer questions. Employer benefits is something that I specialize in. So feel free. I'm going to open up the forum to questions right now.
We do have some questions, so I'm going to start right here. I just want to let you know first that we did get a lot of input that this is very helpful. This one person said they had to redo their insurance 3 times in 9 months, their family, and it's really confusing. So this is a great resource. So I just wanted to let you know that. So we have a few questions here. Some of them you probably answered, but you may want to go over. Does a company need to offer you insurance if you're a per diem worker, for example, a nurse that's per diem?
So you have to find out if your employer, if your contract is, are you a temp? Are you considered a full-time employee? Are you a 1099? The rules have changed around offering coverage to 1099s and per diem. So you have to find out, what does your contract say? If you are not considered an actual employee of the employer, you're a temp or you're a 1099, they're not required to offer you insurance then.
Okay. Now this one you did answer, but someone asked good alternatives to insurance if you have to find their own. I know you gave all those links, and those are really good resources. And just so everybody knows, we're going to be sending you a PDF of this presentation. So I wanted to let you know that. Um, Another question came in. This was about the preventative care.
Yep.
Um, the question is, there's preventative care free on all plans because this specific person I'll just explain. It's not
Sure.
who it is. This person had Cobra and had to get a mammography. Had to pay for the tests as well as for the visit to the doctor for the prescription, and was also charged for the mammogram, and also had to have an ultrasound and was charged for all of that. Is that
So I would find out if the coding by the provider was under preventive, because an ultrasound sounds like what they call diagnostic. So if they think that there's something more, I would look into or call the carrier and find out ask specifically what was the billing coding. Did it go in as preventative? Because you may assume you were going in for preventive and they didn't bill that. They billed it as what we call diagnostic. So find that out. Even they can back out claims if need be, and you can do appeals on them. So I would ask the key things. Was it preventive? Was it diagnostic? Were they looking for something? Did they suspect something? Because oftentimes you think it's preventive and the provider is billing it as diagnostic because they suspect something else.
so? Just to say, in that case, probably the initial mammogram was probably preventative, and then the ultrasound was not.
That's how it sounds, as
but
if the first one, correct, you were thinking was preventive, but the
she could
second
probably
one.
appeal that.
So I would definitely pull up those bills and call the carrier to find out how did it get billed. We don't think about billing, we just think about when we walk into the office, and we don't know what happens when that bill leaves the doctor's office and goes to the carrier.
Okay. Um, Question. It said contraceptives are under preventative and it's supposed to be free, but this person pays for theirs. But I guess this person's father does not work for a religious organization. Should they not be paying, or are there other loopholes besides that?
Yes, there are loopholes on the contraceptive side. If you're getting something that has a generic equivalent, you're going to get billed for it. There is a list. If you went to healthcare.gov, there's a piece there. You can email me and I'll get it to you. Some contraceptives, because there's another alternative or a cheaper alternative, may not be covered. There are some employer groups that were able to opt out beyond just the general religious piece of it. So you can contact me if you have further questions on that, and I can find out or help you find out how or why or what's the other options for you.
It could be the brand, right?
It could be brand. It could be that they don't cover, a specific procedure or something of that nature. It's very generalized, the contraceptive coverage. So each plan may have different requirements.
We just had a lot of people saying thank you. This was really good information. There's no more questions right yet. So if you have any, we do have wait, hold on. Okay, here's a question. I'm going to read this. It's very long. Okay. You are aged, you live at home, you go to the hospital via ambulance for treatment. After 3 days, you are sent to a place for rehab. How can a really aged person determine and be assured whether or not hospital admits you under or observation of actually admitted to the hospital? Oh, the person does not want to pay out of pocket if Medicare and a secondary insurance can cover admission rather than under observation. Oh, I see. Okay, observation.
Mm-hmm.
Okay.
So the whole,
she was missing the OB
mm-hmm.
with observation. I didn't know.
So I think I would have to actually. A lot of hospitals I've seen, instead of admitting you through the ER, they do a 24-hour observation, and that gets tricky on the coding with the carrier because they don't know where to place that. Does it go under ER? Does it go under outpatient? Does it go under inpatient? So that would be something I can't answer on a general basis. If you wanted to, I could work with you and look at that further. ER is a tricky one because you go to the emergency room, you don't know if the ambulance participates, you don't know if the ER doctor participates. what I tell people is, again, look at those bills, call the carrier, appeal it, or resubmit it. Talk to them about the situation, because sometimes you just need a human being to look at your claim and understand what happened from, point A to point B, as opposed to just a computer that got codes and automatically spits out an invoice.
So the computer just sees the code.
Oftentimes,
Okay, got
the
it.
first submission from the provider or the facility is via computer, and it's a computer system that's picking up billing codes. Oftentimes, you have to then do what I call resubmission with a human being actually reviewing those claims.
The person just said thank you for the great advice. And also, don't forget, you can also contact Lisa if you have any other questions. Here's another one. Are you better off getting an insurance broker or shopping on your own if your job does not offer a plan?
So healthcare.gov has what they call navigators. If you call the phone number, I would call before October 1st. October 1st is what they call open enrollment, and they're going to be very busy. So they have navigators. They're not licensed brokers. Like I have to go through several hours of class, and I have to take a test. If you can get a broker, I do advise it. They get paid via commission from the plan. Here in New Jersey, they do. Let me, redo that. Here in New Jersey, unless you're going for to a consultant, oftentimes most of us brokers get paid through the insurance carrier as a commission off of the premium. Individual is a set rate. So I personally would say find a broker. You can go to nahu.com, NAHU, which is an organization I work with. All of those people are licensed, and you can actually find a broker that way in your area. So it's all across the country. All of those brokers are linked in, and they, we get a lot of educational updates through that association. It's something that I'm very involved in. So if you're looking for a broker, go to nahu.com, National Association of Health Underwriters.com.
Okay, here's another good question. This person is working in a part-time position and looking for a full-time job. She's now paying for insurance, and she knows when she was working full-time, they had an open enrollment period, which you just talked about. But now that she's paying for it, is there a specific open enrollment period for her to try and find a cheaper plan?
So if you're paying as an individual, so if you're talking about individual coverage,
yes.
October 1st to December is open enrollment time for a January 1st effective date. If you're talking about employer plans, still whatever the plan renew or contract is, by law they have to have open enrollment at least once a year. Oftentimes it's the 30 days prior to the plan renewing. But for individuals, yes, there is an open enrollment time, and what I call that is the time that you can jump to other plans. You could shop your plan, and you can change plans at that time.
You can only do it between then?
Correct, only once a year. One other thing I didn't put into this, but a lot of people may have COBRA. COBRA is a big topic. I didn't want to confuse, but since we're talking about open enrollment and when we can change plans, if you are getting termed from employment for whatever the reason is, and you have the option for COBRA, you need to decide very quickly between COBRA and individual coverage. Because if you lock into COBRA, you can't come off COBRA unless there's a life event, so you've gotten a job and now you're offered coverage, or your spouse is offered coverage. You can't just jump off COBRA because now it's too expensive and go on to individual coverage. It's also the same scenario if you're being offered a severance package, because your employer is terming you from the plan, paying for your COBRA, right? You have to find out when is your coverage terminating.
That's the next question. Someone just said, what if COBRA runs out in November? Can you join somewhere before January?
Yes. So if you, the other loophole is if your plan ends and you have what we call a life event, you go to healthcare.gov, there's a big list of what we call life events. So you're losing coverage. It's not, I just can't afford this and I'm going to quit. You can come on to coverage at other times in the year.
Anyone have any more questions? We have a few more minutes. Otherwise, oh, hold on. Here we go. Oh, just a thank you.
Oh, you're welcome. It's, health insurance is personal, is what I tell people, and you don't really think about it. Insurance is what you're covering a risk. It's really something you don't think about until something happens. You have to use it. Um, People don't think about life insurance. They don't think about disability insurance until something happens. So since we're all here, I would say just think about where you're going or what your needs are at the time or every time it comes up in employer, with your employer or individual open enrollment. And I think they're doing a pretty good job right now of putting it out there. You'll see advertisements. I mean, you see prescription pharmaceutical out there. Now they're starting to put advertisements for healthcare.gov and other insurance carrier, advertising that, hey, it's time to enroll or look at your insurance.
I just have to ask a question because from seeing this. For the younger people, when a lot of them feel like they don't need insurance. So, but now they'll get a penalty on through their taxes.
Correct. So,
okay, so
depending on their income, so
but there's so many younger
levels.
people. I'm just going to speak for the younger people who just graduated college, who are not making a lot of money. Maybe they're not in their chosen fields yet. They don't have a good job. They don't have enough money to pay for insurance because that's kind of like their last resort that they're going to pay for, right? So, and they don't qualify for a subsidy.
So I would find out first, are you still covered? If you're, a student that just graduated, are you still covered on your parents' plan? Does can you still be covered? Do your parents have coverage? Can they afford to put you onto their plan to your age 26? The second thing is, it doesn't cost you anything. You're not locked in to go and explore healthcare.gov or some of the individual insurance carriers to find out what is the cost. Evaluate that versus the penalty, again, versus the risk of something happen. Think about if I land in the hospital, an emergency room visit, I walk in that door, just to walk in the door, I'm talking $2,000 if I don't have insurance. And I know, we hear about charity care and these other avenues, but I think that's a last resort, and I don't think we should be thinking like that. Again, that's my opinion. But I would evaluate what your full situation is. Can you afford that penalty? Can you afford the risk of something happening? Can you then look and see, do you qualify for a subsidy? Or does your employer offer, or is there a plan that your employer offers to even part-time? There's some plans out there that they're offering to part-time employees that you can link together with other employees or employer groups to purchase. So I would look at all your avenues and all your scenarios.
Thank you. So you're getting lots of thank yous. So we're gonna end now. Thank everyone for attending. Thank you, Lisa. It was very informative.
Oh, thanks. Thanks for having me. Thanks for attending, everyone.
Yeah, if you have any, don't forget, here's her contact info if you want to get in contact if you have any further questions. And hope this helped you. And thank you again. And we will see you again at our next webinar. Thank you.